and information as important as you all will deliver to us today to debate, discuss, and to make decisions so we can put our country and our seniors in the best position going forward. So thank you all for being here. Before I begin, I want to welcome the newest member of the Budget Committee representing New York's 3rd District. I don't know if there he is. Look at him. Thank you, Mr. Tom Swazi, one of my classmates and a true friend and a former member of Ways and Means. Don't know if you're going to get back on Ways and Means or not, but I hope you do because you're a great member. And I'm excited that you're on our committee. This committee continues to grow and heft in the caliber of people on both sides of the aisle, Mr. Ranking Member. So thank you for committing to getting quality people on this committee. Tom, again, congrats on your win and welcome to the team. Also joining us today is Representative Houchin of Indiana, and I don't know if she's actually here yet, but I'm going to ask unanimous consent that Representative Houchin be permitted to participate in today's hearing. We discussed this before, so without objection, so ordered. I also want to welcome our witnesses. Mr. Paul Spitalnik serves as Chief Actuary for the Centers for Medicare and Medicaid Services, and Mr. Stephen Goss. Thank you all for being here. He serves as Chief Actuary at the Social Security Administration. And we appreciate your time and your insights this morning. I'm going to yield to myself for an opening statement. I always say I'm going to attempt to make it short, but since we've been delayed this morning, I will simply say thank you for being here. We try to start, my ranking member and I started this conversation in the 118th Congress in his new role and my new role with a few things, commitments. One was for good debate, but productive debate and try to dispense with some of the ancillary partisan stuff. And so focusing on policy and substance. The other was, let's agree on the math on our balance sheet. Like Democrats may have some of their own ideas on how to address our rapidly deteriorating fiscal health, and Republicans may have their ideas, but we should all, I think, at least acknowledge, and we have, that the situation that we face is unsustainable, and something has to happen. I was encouraged also that, and that I give my ranking member as much credit as anybody, that we were going to try to work together as much as we can, where we can find agreement, to fix a budget process that has failed us and is failing, I should say, maybe to motivate members to do what every American family, business, state and local government has to do, and that's develop a budget, enforce the budget, if you will, live within your means. That's just not happening in Washington, and it hasn't happened. And speaking of things that haven't happened here, we got a budget out of this committee, albeit a Republican budget, and it was a budget that was passed on a partisan basis, so I acknowledge that. It's our sort of Republican blueprint for how we would manage the fiscal affairs of this country, okay, and address the deficit and the debt. But we haven't had an oversight hearing, gentlemen, in over 6 years. So we're going to exercise our oversight responsibility. The third thing that I would suggest is a new phenomenon here, sadly enough, for this committee, is you all haven't presented in 12 years, is my understanding. They haven't presented the numbers on the trust fund to the budget committee, who is supposed to steward the nation's resources. And by the way, purely analytical here, this is just a purely analytical statement, and I would like for you guys to confirm it or deny it in your comments and in your remarks this morning. But of the 30-year unfunded liability that our nation has on its books, and that represents, Mr. Scott Peters, $140 trillion, 98 to 99% of it are the two programs that are represented by these gentlemen. So there's that fiscal impact. And then there's the deeper and maybe even just more personal, getting away from the numbers, the impact of doing nothing. That is, Republicans claim we have plans to address it, but words are cheap, and we haven't enacted any of those plans. So as we say, Scott, in the church, faith without works is dead. And I've heard a lot of plans from my Democrat friends. And no matter how well thought out those plans may or may not be, faith without works is dead. So just a lot of lip service from a lot of people, which is why we also did something that was unprecedented in a decade. We passed a bipartisan commission that would have knuckleheads from both sides of the aisle who would, in all seriousness, thoughtful leaders in a bipartisan way, looking at two of the most important programs for our seniors. Retirement security, healthcare security, 60+ million people today counting on it, 10,000 people a day counting on it. And if we do nothing, and let's make sure this is clear, and then I'm done. If we do nothing, Ms. Schakowsky, nothing. If we do nothing, I don't want to touch it, because if somebody's going to send out a mailer that shows y'all throwing grandmother off the cliff, and we're not going to touch it because some organization on the outside is going to say it's a backdoor way to tax the American people and stab President Trump in the back and all these crazy things. This is how this town keeps us from being the kind of leaders that our nation needs now more than ever. So my prayer is we unite, not as Republicans and not as Democrats, but as Americans. And Tom Suozzi's capable of that. That's why I'm encouraged. He's an add. He is an add. He is a value add to this committee in that regard. So I won't get everything I want to solve it probably. They probably won't get everything they want, but we must do it, or there will be an automatic cut. We will not have not only not saved the program and strengthened it, we will have caused it to basically collapse in terms of insolvency, and there will be an automatic cut to beneficiaries. On Social Security within 10, and we got a little bit of grace in the last set of numbers on Medicare, but that's going to happen in that program too if we don't do something about it. So God bless America. Let's get to work. My ranking member now, as much time as you may consume.
Yeah, thank you, Mr. Chairman, and I want to thank our witnesses, Mr. Goss and Mr. Spitnalnik, for both being here today. I also want to welcome back my good friend Tom Suozzi, welcome him to the Budget Committee, and just let me already depart from my prepared text, which will probably be the rest of my remarks, departing from my prepared text. From the very beginning, a year and a half ago, Jodey and I, the chairman and I, both said remarkably similar things our first day. And I do feel that we have largely 18 months later stuck to that essentially trying to split issues into two different camps. That on the first set of issues, we were really going to try to work in a genuinely bipartisan way, that there were things that this committee could and should be doing, such as oversight, especially in areas that hadn't taken place in quite a while, that we should be in the habit of doing markups, which we have done. Finding bipartisan wins, recognizing that the House is narrowly Republican, the Senate is narrowly Democratic. If anything is going to be passed and signed into law, it is going to be, by its nature, bipartisan. And also doing so in a way that shows the seriousness of the work of this committee. There are plenty of others on Capitol Hill where they engage in the food fight and the nonsense. That's not why I'm here. I know that's not why the chairman is here. And I think that tone that we have both worked to set has really been followed through by the members of this committee. And I was so pleased when yesterday someone interviewing me complimented both of us, who has been watching our hearings and has noticed and commended both of us for that. So that's on the first thing. On the second, though, quite appropriately, there are also a set of issues that do lend themselves to strong partisan differences because they reflect the honestly held ideological differences between a proud conservative from West Texas and a proud Democrat from Pennsylvania, especially one who grew up in a labor family. And I do think Social Security and Medicare certainly are in that latter category. When I think of two of the main reasons why I am a Democrat, Social Security and Medicare would be two of the first things that I would mention. They represent the core of the coalition Franklin Roosevelt put together a century ago, and that really is the heart and soul of the Democratic Party, to fight for hardworking Americans like the families in my district and certainly the family in which I was born and raised. Social Security is the greatest anti-poverty program in American history. And then Medicare, the idea for it, of course, was first laid out by Franklin Roosevelt, wasn't achieved in his presidency. Harry Truman really picked up the mantle and fought valiantly for it, wasn't able to get it done. And then finally, in 1965, Lyndon Johnson, with a retired and much older Harry Truman standing right next to him, was able to sign that into law. So I believe deeply in Social Security and Medicare and what they represent even beyond the paychecks. What they say to the American people is that we have a basic commitment to all of those who are in our society that we are going to take care of you when you most need it. We're not going to allow you to retire into poverty or essentially die prematurely in old age because you lack health insurance and can no longer work. So that is what I believe, and with those principles guiding me, I have certainly worked to do everything I can to ensure that Social Security and Medicare will be there, not just today for my father, who is on both, after working in manual labor jobs for more than a half century, paying into the trust funds for both, but that it will be there for myself when I retire and my generation, as well as the generations to come. Now, we have, as I'm sure we'll hear more about, the good news that we have until 2035 for the combined Social Security and Disability Insurance Trust Funds, as well as 2036 for Medicare. But ultimately, Congress must ensure that these programs have the resources to continue paying full benefits. As you gentlemen know, I am attempting to put our money where my mouth is, and not just saying that we should have more funds, but actually putting legislation into place, or at least co-authoring it, to ensure that we would have that. I am proud that I have introduced the bill along with my counterpart, the lead Democrat on the Senate Budget Committee, Sheldon Whitehouse. The name of the legislation is the Medicare and Social Security Fair Share Act, which honors the commitment that I have just spoken about by closing corporate tax loopholes and equitably applying the payroll tax to the top 2% of earners. Both the actuaries with us today have verified that my bill would extend the solvency of Social Security and Medicare indefinitely, and all without raising taxes even one penny on Americans who are making under $400,000 a year. So that is one approach, and it is the approach that poll after poll has shown is supported by the vast majority of Americans, even a sizable number of Republicans who are polled when asked about that approach. However, to be fair, that is not the only approach that is out there. And in the interest of bipartisanship, Mr. Speaker, I believe the Republican Study Committee budget is not getting as much attention as I think it should. So let me help my Republican friends with that and get a little more PR for their budget. And I would say, while it's the Republican Study Committee budget, not the budget that was pass out of this committee. 80% or so of House Republicans are a part of the Republican Study Committee, including, I believe, every member of Republican leadership. So it's not exactly like we're talking about some small group. Their proposal, and I give them credit for honesty, because they put this out and put it in black and white, their plan cuts Social Security benefits for 257 million people. That's 3 out of every 4 Americans. They would do that by raising the retirement age from what will soon be 67 all the way up to 70. That is completely unnecessary, and let me be clear, represents a cut, and a substantial cut, because of course Americans would never earn back the revenue they would have received without some sort of an increase in the retirement age. I finally want to make this point and pause it there. There's a lot of confusion when people bring up about deficit and debt, and understandably get concerned about some of the projections, get concerned about the $34 trillion debt figure. Let's be clear, Social Security has not added 1 penny to our national debt. So let us not make the mistake of confusing a conversation about our annual deficits or the cumulative deficits, meaning our national debt, and the solvency of Social Security or the solvency of the Medicare trust funds, which are entirely separate issues. With that, I see I've already gone over my time. I appreciate the indulgence, Mr. Chairman, and I yield back.
I may be accused now from my colleagues of letting you go 3 minutes and 45 seconds.
That's the first time I've spoken longer than you in, in a year and a half.
You're due at least 3.5 minutes, I admit. So let's introduce our guest, and then we'll start the questioning with the limited folks who are here. And by the way, we've got a lot of things happening. I know this is an important issue for every member on the committee, so we want to get to your presentations. In the interest of time, any member wants to give an opening statement, I ask that you submit it for the record. And we'll hold the record open to the end of the day to accommodate those members who may not yet have prepared written statements. Once again, to our witnesses, thanks for being here today. We're going to yield 5 minutes for your opening comments. So, Mr. Spitalnik, would you please kick us off with your presentation, your opening remarks, sir?
Thank you. Good morning. Chairman Arrington, Ranking Member Boyle, distinguished committee members, thank you for inviting me to testify about the financial outlook of the Medicare program. It is my pleasure to represent the 100 professionals working in the Office of the Actuary at the Centers for Medicare and Medicaid Services. One of our many responsibilities includes to support the Medicare Boards of Trustees in their annual report to Congress. I'm pleased to speak to you today regarding the key findings from the 2024 Medicare Trustees Report. Medicare helps pay for health care services for the aged, disabled, and individuals with end-stage renal disease. In 2023, Medicare covered 66.7 million people, 59.1 million aged 65 and older, and 7.6 million disabled. And for the first time in history, Medicare expenditures exceeded $1 trillion, amounting to $1.037 trillion, while total income was $1.025 trillion. Assets held in special issue U.S. Treasury securities decreased by $12.4 billion to $396.7 billion. The Medicare program has 2 separate trust funds, the Hospital Insurance Trust Fund, HI, and the Supplementary Medical Insurance Trust Fund, SMI. HI, or Medicare Part A, helps pay for inpatient hospital, hospice, skilled nursing facility, and home health services following hospital stays. SMI consists of Medicare Part B and Part D. Medicare Part B helps pay for physician, outpatient hospital, home access to drug insurance, home health, and other services for individuals who have been voluntarily enrolled. Part D provides subsidized access to drug insurance coverage, also on a voluntary basis. Medicare also has a Part C, which allows beneficiaries to enroll in and receive care from private Medicare Advantage organizations, with payments being made from both the HI and SMI Part B trust fund accounts. About 48% of all Medicare beneficiaries choose to enroll in a Part C plan in 2023. The financial statuses of the HI and SMI trust funds are evaluated separately because HI and SMI are financed in very different ways. Within SMI, Part B and Part D beneficiary premiums and government contributions are established annually to cover expected costs for the following year. In contrast, HI is subject to substantially greater variation in asset growth since employee and employer tax rates do not change or adjust to meet expenditures under current law. The HI trust fund is projected to be depleted in 2036, when revenues are projected to be 89% of expenditures. If assets were depleted, Medicare could pay health plans and providers of Part A services only to the extent allowed by ongoing tax revenues. To date, Congress has never allowed the HI trust fund to become depleted. The trustees also estimate the long-range HI actuarial deficit to be 0.35% of taxable payroll under current law. With the financing established annually, the SMI trust fund is always in actuarial balance. As SMI per capita benefits grow faster than average income or per capita GDP, the premiums and coinsurance amounts paid by beneficiaries represent a growing share of their income. Similarly, rapid SMI cost growth places a greater demand on the federal budget. Government contributions to the SMI program are estimated to constitute 16.9% of federal income tax receipts in 2023 and to exceed 30% in roughly 40 years. The financing challenges to the Medicare program include the projected depletion of the HI trust fund, this fund's long-range financial imbalance, and the growth in Medicare expenditures. Furthermore, should certain price updates specified under current law prove to be problematic, expenditures could be even greater than those presented under the intermediate assumptions of the 2024 report. To help illustrate the potential magnitude of this understatement, a set of Medicare projections has been prepared under a hypothetical alternative in which Medicare spending reflects less than full implementation of reductions to provider payment updates required under current law. Under this illustrative alternative scenario, Medicare costs as a percentage of GDP continue to increase from 3.8% of GDP in 2023, reaching 6.4% of GDP in 2050 and 8.4% in 2098, considerably higher than the values under current law of 5.9% of GDP in 2050 and 6.2% of GDP in 2098. I welcome the opportunity to assist you in your efforts to ensure the future financial viability of the nation's most critical program to promote the health and income security of our senior and disabled populations. I look forward to answering your questions.
I thank the gentleman. Now yield 5 minutes to Mr. Goss for his opening statement.
Thank you very much, Chairman Arrington, Ranking Member Boyle, members of the committee. Thanks for the opportunity to talk to you today about the financial status of the Social Security Trust Funds, or Solvency, and implications for the federal budget and debt. Social Security is off budget, of course, as we know technically, and its operations are accounted for in the context of trust funds, which are separate legal entities from the general fund of the Treasury. The only sources of revenue for OSI and DI trust funds are the dedicated taxes paid by covered workers and beneficiaries, which are invested daily in Treasury securities, plus the interest on those securities. Future benefits are not promises or really liabilities. They can only be paid to the extent that there are asset reserves in the trust funds, as Social Security has no borrowing authority. Should reserves become depleted at any point, benefit payments would be limited to the amount of continuing receipts. In this case, trust funds would not run out of money. They would simply need to pay less than the full amount of scheduled benefits. It is for this reason that the Congress has always acted timely to avoid trust fund reserve depletion over the 85-year period, 1940 through 2024. The total federal debt subject to limit is the result of borrowing required by the general fund of the Treasury to finance federal expenditures from the general fund in excess of collected revenues other than those dedicated to the trust funds. The current level on your webpage of total federal debt subject to limit is near $35 trillion at this point. In contrast, Social Security can only hold positive trust fund reserves, $2.8 trillion at the beginning of 2024, which are invested in or loaned to the general fund on behalf of future beneficiaries, that is the public, that lessen the amount of that Treasury would otherwise have borrowed directly from the public. Redemption of trust fund reserves to pay benefits has no effect on total federal debt. It just replaces debt owed to future Social Security beneficiaries with debt owed directly to the public. In addition, if trust fund reserves were allowed to become depleted, current law would not allow transfers from the general fund, thus increasing publicly held debt in order to pay full scheduled benefits. The often cited Balanced Budget and Emergency Deficit Control Act of 1985 says to assume that resources will be adequate to make payments required by law. Social Security benefits beyond the balances available in the trust funds are not allowed, much less required. The 2024 Trustees Report indicates that the cost of paying currently scheduled OASI, retirement survivors benefits, will exceed income in all future years, causing the OASI trust fund reserves to decline from $2.6 trillion at the start of 2024 to reserve depletion in November of 2033, at which point 79% of scheduled benefits would be payable. This projection is slightly improved from that in the 2023 Trustees Report because the economy and employment grew much more in 2023 than had been assumed in the 2023 report. The DI trust fund reserves are projected to continue rising in the future with annual income exceeding cost of paying scheduled benefits through 2100 and beyond. Now, on a combined basis, the OASI and DI trust fund reserves will decline from $2.8 trillion at the beginning of 2024 to depletion in June 2035, at which point 83% of currently scheduled benefits would be payable. We note that the current projection of OESDI trust fund reserve depletion in 2035 stands in contrast to the projection for reserve depletion in 2063 that was made at the enactment of the 1983 amendments. While OESDI cost as percent of GDP is now 5% lower than projected back in 1983 and will be through 2035, OESDI cost as percentage of our taxable payroll, our tax base, is now 5% higher than had been projected back in 1983 and will be through 2035. The primary reason is that the earnings of the top 6% of workers whose earnings exceed the taxable maximum level under Social Security unexpectedly grew considerably faster than for the other 94% of workers between 1983 and 2000, lowering the percent of covered earnings that is actually taxable from 90% in 1983 and expected in the future then to just 82.5% by the year 2000 and thereafter. The changing age distribution of the population due mainly to reduced birth rates since 1965 and the improvement in life expectancy were well anticipated and accurately anticipated back in 1983, but were not fully addressed with a permanent solution at that time. With the reduced share of earnings now subject to OESDI payroll tax since 1983, the need for further legislative change has been accelerated, and we look forward to working with you on developing these changes.
Thank you, Mr. Goss. We'll now move to the question and answer portion of our hearing. I'll start with 5 minutes, and we'll have our colleagues also have 5 minutes to dialogue. Mr. Goss, let's pick up with where you left off on the Social Security Trust Fund. How many people are going on to this earned benefit program a day? Is it true that it's 10,000 a day? The retirees that are entering that program as beneficiaries?
I think that's very, very close to the market. It depends a little bit on the nature of the economy at the moment, job opportunity, but yes, because of the surge of the baby boom, are reaching retirement age now, we're having a large influx.
My understanding, it's the largest generational retirement in the history of the world. And so that's an important trend I think we need to consider as we're talking about making this program work, not only for seniors today, but solvent and effective for the retirement of seniors in the future. The only responsible way to look at this, right, is to think about seniors today and our children. Let's talk about another trend, worker per retiree or per beneficiary. Is that a ratio that's going up or down, the worker per beneficiary ratio?
The workers per beneficiary is indeed going down. really just because of the demographics.
Okay.
One thing that's saving us a little bit on that is while the so-called baby boom generation is reaching retirement age, I mean, they're starting to get benefits, they are also working longer to higher ages than prior generations. So we're getting some help on that. But the worker to beneficiary ratio is definitely declining over time.
Okay, so that's a pretty challenging set of forces on the solvency of the program. 10,000 a day coming onto the program and the basis of revenue stream to support it. And it was set up to be self-sustaining, but that's not a self-sustaining set of trends. That math won't work, and it won't work even according to the trustees and your report. It will become insolvent by when? 2033?
Well,
Where we aren't bringing enough revenues in to pay the full benefit to every 60-plus million beneficiary who has earned this benefit from this program.
2033 is
Okay.
exactly right for the separate OASI fund. Got a combined basis, it's 2035.
So on the current path, with the current trends, by 2033, what will be the cut in what did I say,
2035.
2035?
So 2035 for the OASI and DI funds on a combined basis.
Okay. Within roughly 10 years,
Yeah.
there's going to be a point at which we're not able to pay beneficiaries their full amount. How much will they take in a automatic cut if we as Congress don't do something, whether it's a programmatic reform to make it more sustainable or a pay-for to make it sustainable? What's that cut look like?
We are confident you all will make these changes, but if, as you're suggesting, we did not have such changes, we'd be in a position in 2035 of being able to pay only 83% or a 17% reduction in total expenditures that could be made compared to what's intended for the full scheduled benefits. That does not necessarily mean an
What's the
across
cut
board.
that seniors will take? What's the cut to their benefit that they will take?
17%
Automatic
on
cut.
average. On average.
Automatic cut. Seniors need to hear that. 17% automatic cut if we do nothing, correct? Okay, and you have more confidence in Congress than most of our constituents. But it happened. It happened back in the 80s. When was the last time when this program was close to insolvency? What happened? When did that happen, and what happened, and how did they address that solvency, and who addressed that solvency?
Well, the last time was really in 1982 when the combined program was approaching this, and the Congress did act. There was the so-called Greenspan Commission, which came up with some ideas. Congress extended that and completed that, and we had the 83.
Let me ask you this, Mr. Goss. Was the Greenspan Commission, did it precede the final deal that was voted on by the Congress? That is, the Greenspan Commission, and was it a bipartisan commission?
It was a bipartisan commission.
Okay, so there's a bipartisan commission. They're looking at ways to find consensus to make this work. And then let me just kind of fast forward, get to the punchline. President Ronald Reagan, beloved Republican leader of our country and American leader of our country, and Tip O'Neill, and Democrats and Republicans all came together to support it, to do what was right for our country, for our seniors. Were revenues and expenditures part of that combined reform initiative to make it solvent into the future?
They were indeed.
Okay,
It was a-
so I'm going to yield, but just to put the sharp point here on the end of this conversation, the last time we were facing insolvency, Republicans and Democrats came together through a mechanism of a commission, bipartisan, and then you had a Republican, very conservative president and a liberal speaker in Tip O'Neill, and they struck a deal to save Social Security, and they had both pay-fors and programmatic reforms as part of their overall initiative. I suspect that's probably what's going to happen in the future if we're going to do it. So with that, I'm going to ask my ranking member for his Q&A.
Thank you. And Mr. Chairman, before I start my questions, I ask unanimous consent to submit a statement from Max Richtman, the President and CEO of the National Committee to Preserve Social Security and Medicare, that the statement be submitted into the record.
Without objection, so ordered.
Thank you. So just a few different points that I want to kind of drill down on. First, we had this conversation about 2033 versus 2035. Some of the confusion might be that the projections from CBO just a couple of years ago were that we had until 2033. We have gotten good news of late, both when it comes to Social Security and Medicare, that actually we have a couple more years of full solvency, 2035 Social Security, 2036 when it comes to Medicare. That is because of stronger economic growth than was projected just a couple of years ago. So did you want to speak about that and draw the link between the two and why it is that now we do have until 2035 and 2036 respectively instead of a date that is closer?
I think over that time period, the improvement we've had is largely because of the economy. There's been improvements in productivity and the labor force that has brought in more revenue than it has resulted in an increase in cost. And also employment rates have been very strong. And one of the things that's been really good is, as mentioned already, with the retirement of the baby boom generation upon us, elders are working to higher ages now, which is a very, very positive effect.
So it's not just in Congress that. So I don't know if you have anything you wanted to add to that.
There's a very similar story on the Medicare HI Trust Fund as well. Just 4 years ago, the trustees were projecting that the HI Trust Fund would become depleted in 2026. And as you noted in the 2024 report, the depletion date is now 10 years later, 2036. That is a dramatic change, and there has been a dramatic change in the underlying finances of the program, both on the income and on the expenditure side. On the expenditure side, the projections from 2020 to 2036, the point of where we're now depleted, projecting HI depletion date, expenditures are now projected to be 3.2% lower than what they were just 4 years ago in the 2020 trustees report. At the same time, the income projections are up 11.6%. And so there's just a dramatic change in the income projections coming into the HI Trust Fund.
Yes, quickly because I want to get to my next topic. Yeah.
If I could just add, actually, the Social Security combined trust fund reserve depletion date has been projected within the range of 2033 and 2035 for the last 13 years. We're at the top end of that now, so it is more positive, but it's been a very stable projection.
Well, whether it's Medicare or Social Security, obviously the good news of this strong economy obviously helping us and giving us more time to grapple with this issue here in Congress. Now, let me transition to immigration. Very simply, does immigration help or hurt the financing of Social Security and Medicare?
Well, let me start at least. Immigration typically is for people who are in their 20s to maybe late 30s. So generally speaking, when people enter the country as immigrants, along many cases with children, but people of working age tend to be of younger age. Therefore, when they come to the country, they tend to come here for economic opportunity and enter the labor force, and that's very much a positive. That actually helps us with having more revenue coming in. Eventually, they will develop insured status and be able to get benefits.
Although not necessarily all of them. We will have some people who are actually literally paying into the system, but will actually never receive benefits decades later.
Absolutely. And another positive is that people enter in their 20s, 30s, et cetera, as immigrants. They may have children along the way, and that adds to the births that we have in our country that helps solve some of our problem with the low birth rates.
Especially given every country in the Western world is challenged from a birth rate perspective and will increasingly be challenged over the next 40 to 50 years. We discussed this separately, it turns out. I mentioned this in my opening remarks, and you also touched on it as well. But I just want to make it, again, crystal clear for everyone. Social Security does not add one dime to our national debt. Can you just briefly, again, explain why that is?
Well, that's exactly right. Social Security does not have any authority in the law to have any borrowing. Again, it can only spend, the money that goes into the trust funds is dedicated just to go in the trust funds, and it can be used only for one purpose, for paying expenses of Social Security. It can't be used for any other reason. This is because of the laws that you all have passed. Again, any money that comes into the trust funds and builds up reserves that we have now, the $2.8 trillion, actually helps cover some of the roughly $35 trillion of overall debt we have. If we spend down the trust funds, that doesn't increase the total debt subject to limit. It just simply means that it gets shifted from a little bit less of it, or over time less of it, being covered by the monies that are owed by the general fund of the Treasury to future beneficiaries, to more of it being covered by borrowing directly from the public. But both of those borrowings are both in the public interest, obviously.
Thank you, and I'll yield back.
You still have 3 more minutes, I think.
No.
that's a joke.
Oh, okay, all right.
The gentleman yields. The gentleman from Wisconsin, Mr. Grothman, is recognized.
I thought you not sitting in the chair, you weren't.
Is this on? I guess it is. Okay, Mr. Spitalnik, the Medicare trustees report states that the hospital insurance trust fund expenditures will rise faster than income in the next decades. Can you explain reasons why expenditures are going up quicker than income? Then I'm going to give you a question I don't know that you're qualified to answer.
Sure. There's several reasons why expenditures out of the HI Trust Fund are growing faster than the income. My colleague, Mr. Goss, mentioned a most significant one, and that's the changing demographics. That as the baby boom generation in particular has been retiring, they are moving from the employed paying into the program into beneficiaries receiving benefits from the program. And so that demographic shift is the largest component of why that shift is occurring.
That makes sense, but how much are we spending, say, per 70-year-old, per 72-year-old, whatever? How is the healthcare spending per person going up relative to inflation?
On a per capita basis, spending in the Medicare program has actually been tracking pretty closely to the general inflation rates. So there's been pretty consistent increases in the recent past. In the trustees report, there is projections that those per capita costs will increase at a faster rate in the near future and into the future, mostly because healthcare costs tend to increase faster than other sectors of the economy.
That's exactly what we're trying to get at. So, but there are a few years lately that hasn't been going on, but in general, healthcare costs are going up quicker than in a general inflation rate, right?
Yes.
Okay. Do Medicare costs vary dramatically from one part of the country to the other?
There are certainly regional variations. There are differences in Medicare spending in urban areas versus rural areas, for example. But there are consistencies across areas as well.
Okay. Could you give me some examples, like some states that are low, some states that are high, and the degree to which there's a variance from state to state?
The one that jumps to mind is, in particular, with respect to the Medicare Advantage program, when Medicare rates are set, they're set at a county level. And so, for example, Medicare spending in Miami County is typically higher than in most other parts of the country. So that's just one example.
Give me an example of how much higher, just dollar-wise. I've heard that before. Miami is high.
I'd be happy to give you the follow-up with the details on that.
Is it, do you know, just, is it great? Is it like 5% higher, 25% higher?
It is many percent higher.
Like 25?
I don't want to misspeak, so.
Okay, it's not fair. Because you didn't come prepared for that today. I wonder, though, if you do get the answers for the committee, if you could, tell us where we would be at. Could we solve this problem if everybody were at, say, the lower fifth of spending per person on Medicare? Would that be enough to make a real dent in the problem?
There have been theoretical exercises of can you, if payments in the highest county were replaced with payments at the lowest county, would that solve the Medicare problem? I think from a theoretical perspective, that's accurate. From a practical perspective, it's not really all that meaningful.
I don't know, but that's an interesting thing. Okay, we'd love to have that. Mr. Goss, labor force participation rate. Can you tell us what, right now, a lot of people, they retire, and as a result, the restrictions on how much they can make before we begin to reduce the Social Security benefit, right? Where's the cutoff there? 19,000, 20,000? Where do we begin to say you get less money the more you work?
Excellent question. I think it's in the order of between 15 and 20,000. I don't have that exactly at my fingertip. But an important part of that is the reduction from the retirement earnings test only applies for people up to age 67. At 67 and above, where people can receive benefits without any effect. And
Are you sure 67 could be higher than that?
well, currently it's 67. It's at the so-called normal or full retirement age where the retirement earnings test stops applying. But the good news is that if anybody receives a reduction in their benefit, if they start receiving benefits before 67, and then they receive a reduced monthly benefit at any point before 67, we will recompute your benefit as of 67 and for thereafter, and take away the reduction for having received benefits
You get
in
more
earlier
forever.
months.
Okay, and I would just go on record as saying the idea that the normal retirement age is 70 is crazy.
Gentleman yields. Thank you. Gentlewoman from Illinois, Ms. Szyszkowski, is recognized for 5 minutes.
Oh, there we go. Okay, thank you. Thank you, Mr. Chairman, whoever is here. Glad to see you. So let me say to my Republican colleagues, when you talk about cutting Social Security and Medicare in any way that is reducing the benefits, I say to you, make my day. These are, as our ranking member said, the most popular programs in the country. The vast majority of Americans rely on them. And the very idea that the only way that we can solve our economic problems is to cut these programs, make my day. And let me just say this. There are 67 million Americans right now who rely on Social Security. And let's once again say that this is not an entitlement program. These are people who have paid every paycheck to have this earned benefit, and the idea that it would be cut. We did confirm, and you have confirmed several times, that Social Security does not add a penny, Mr. Goss, to the deficit that we have. But what I did want to say to the chairman of the committee who was saying we have to do something, there was also discussion, there is a something. There are a number of somethings that are going to be done. And I wonder if you could just briefly talk about we do need to act, and that there are plans to do that.
Well, plans, there are a number of potential plans.
Yes.
We have developed estimates that are up on our webpage for various kinds of approaches. Back in 2016, we developed estimates for a plan by Representative Ways and Means Subcommittee Chair Johnson for changes which were largely benefit reductions. We developed estimates for a number of members of Congress, including Ranking Member Boyle and others here, many people in the Senate and in the House who've developed proposals that would largely bring in additional revenue. As Chairman Arrington mentioned, obviously, there are a lot of possibilities here, and we have estimates that would close the gap, and I think, as Mr. Boyle already indicated, the estimates that we developed about a year ago for the proposal would not only close the 75-year gap, but also put us into something referred to as sustainable solvency. So we would be projecting that the trust funds would not be declining and becoming depleted anytime in the foreseeable future. So there are many possibilities here. We just need to.
Many possibilities, and I want to get on to your bill that I think is a really good one.
Yeah.
I wanted to ask Mr. I'll get it, Spitalski, is that right? Something like that? I'm sorry.
I would say close, but.
Nick, Nick.
Spitalnik.
Okay, I'm sorry. So when it comes to Medicare, I wanted you to say, to tell me, are we seeing that the, even just the talk about negotiating for lower drug prices has decreased the number? I know that we're going to, that the full effort of negotiating for lower drug prices is going to be coming in full force, but aren't we seeing that even the hint of it has lowered the cost of drugs?
So the Inflation Reduction Act, which introduced a whole host of provisions affecting prescription drugs in the Medicare program, has a lot of different effects. Some are benefit expanding and therefore cost increasing onto the Medicare program, and others, such as the negotiation provisions and the linkage of prices to CPI, are cost reducing. And so the net effect of those plays out over time. Initially, there's the impact of the Inflation Reduction Act is actually cost increasing, but ultimately we do expect those negotiation provisions and those other cost containments in the Inflation Reduction Act will lead to spending reductions.
Right, am I almost out of time? I guess I am. I did want to just say, I think we have to do something about Medicare Advantage. I think there needs to definitely be some more control over Medicare Advantage that we have right now. And, oh no, I'm not out of time. Okay, good. I wondered if you could talk a little bit about that. We have seen that there's overpayment right now in, am I not? Oh, I'm over time. Okay, I yield back.
Thank you. Now recognize the gentleman from Virginia, Mr. Good, for 5 minutes.
Thank you, Mr. Chairman, and thank you again to our witnesses. I'm disappointed to hear the previous member that was speaking from the minority side said that talk of cutting Social Security and Medicare benefits makes her day. She's the first person I've heard mention that today. So that's kind of disappointing. That would be exciting to someone about talking about the opportunity to cut Social Security and Medicare benefits would make her day. Mr. Goss, is it Goss or Goss? I'm sorry.
Goss.
Goss, thank you, Mr. Goss. Were you suggesting earlier that we have true cash reserves in the Social Security Trust Fund versus an IOU, and that those funds aren't being effectively used to cover other deficit spending?
We certainly do. We have $2.8 trillion of excess taxes that were paid in by American workers and beneficiaries, and were invested in the trust funds.
What's our unfunded liability now on that, on Social Security?
Well, we actually, per the Federal Accounting Standards Advisory Board, we don't really talk about it as an unfunded liability, but an unfunded obligation in the future. A little semantic difference there. But that is, I don't have the number exactly, but it is many, many trillions of dollars. All that represents is the shortfall in the future of the total amount of scheduled benefits under law versus what we have scheduled for revenue. And we know we have to better align those in the future.
Yeah, so wouldn't it be true that Social Security and other mandatory programs are matching, if not exceeding, total tax revenue at this point?
I'm sorry, could you?
Total mandatory programs, including Social Security and Medicare, do they not match or if not exceed total revenue coming in at this point?
Well, at this point, Social Security at this moment is, in fact, its expenditures are exceeding the amount of revenue coming in.
fair
And
point.
that's where the trust fund reserves.
Because every discretionary dollar we vote on is borrowed. Every single discretionary dollar is borrowed, right? We recognize that. Would either of you venture an estimate on what's the typical lifetime payment into Social Security versus the lifetime typical benefit, dollar-wise? How much is a typical person has paid into Social Security now versus over the lifetime what the recipient benefit is?
We have a number of actuarial notes up on the web addressing that, and the interesting part of that is it's a question of whether you compare the amount that individuals have and are expected to contribute under current law tax rates versus, then the question is, versus the benefits that are simply scheduled in the future or the benefits that will in fact be payable under current law. If you look at the scheduled taxes for an individual to pay at various different earnings levels compared to the scheduled level of benefits, which, as we know, we're underfinanced for actually paying those, that looks very generous, but it's not possible under current law. And of course, the ratio of what you can expect to receive to what you've paid in does vary because we have a progressive payment system for Social Security, as we're all well familiar. The benefit formula favors those with the lower earners.
The typical person paying into Social Security pays about how much per month for, say, 40 years? And so therefore, at the end of when they retire, they've paid how much in versus how long they typically receive Social Security and how much that monthly benefit is? Surely you have some estimate of how those two numbers compare.
So try to do a little bit of arithmetic real quickly here. If we have a $60,000 a year worker or $5,000 a month and they're paying 6.2% of that themselves.
So $300 a month, $3,600 a year, take that times 20 years, that
Right.
would only be $70,000. All right, that person at retirement is going to receive how much of a monthly benefit on average?
I don't have that number right offhand, but it's.
Well, it's going to be a lot more than if you, let's say an average recipient's 20 years at $1,500 a month, that's $18,000 a year. $18,000 a year times 20 years is $360,000. You just told me they were paying $70,000 in and receiving, with that estimate anyway, $360,000. When Social Security was first began, how many payees or payors paying into it versus the recipients? What was that number like?
Well, when Social Security first began, the ratio was something.
30 to 1, something like that?
41, but of course.
40 to 1?
Yeah.
What's the payee versus recipient now?
It's now between 2 and 3, and we're heading down towards 2.
2 or 3 to 1, right.
Yeah, but of course, remember at the very beginning, beneficiaries could only get a benefit in 1940 if they'd worked for at least 2 out of the 3 years prior to that. So not many 70 to 80 to 90-year-olds were eligible for a benefit. That's why that number is kind of a little bit
So would you suggest Congress does need to act to preserve and protect Social Security so that it's sustainable?
It absolutely does need to act. Yes.
Thank you very much. I yield back.
Thank you. And now I'll recognize for 5 minutes the gentleman from Michigan, Mr. Gildee.
Thank you, Mr. Chairman, and thanks to our witnesses for being here. And following on my colleague, Mr. Good's comments, which I think do a good job of daylighting the fact that we have a problem, I think where we maybe diverge is how we address that problem and what the solution looks like. I represent people in Michigan. In my home state, over 2 million seniors rely on Social Security and Medicare just to make their ends meet. For many of those seniors, it's their most important source of retirement income. Some, it's their only source of retirement income, and Medicare is their sole healthcare coverage. These programs aren't handouts, as we know. Americans contribute to Social Security and Medicare with every paycheck and have a right to expect that they'll be there as promised when they retire. That's sort of the deal that we made. When you work hard, you play by the rules, you make the contributions, you ought to be able to retire with dignity. That was conceptually why Social Security and Medicare were put on the books in the first place, to prevent the kind of senior elder poverty that was so prevalent before these programs were in place. Now, we've put forward, on this side of the dais, our solutions to shore up the Social Security trust funds, and simultaneously, by the way, increase benefits for future retirees. And we do so by making the wealthiest Americans pay their fair share. Now, not everybody has to agree with that, but we put our plan on paper and have presented it. And it stands in pretty stark contrast to what proposals by Republicans. Now, maybe not all, but the Republican Study Committee, which represents 80% of Republicans in the House, recently released their budget plan, and under that plan, they proposed cutting benefits in order to deal with this problem. $1.5 trillion, in fact. Their proposal, which raises the retirement age, listen everybody out there, raises the retirement age and cuts benefits, is not the way to solve this problem. For millions of the people I represent, just getting by, that kind of talk scares them. So the answer, I don't believe, is to cut benefits, but to deal with the problem at its core. So if I could start with Mr. Goss. For a person making $400,000 a year, this question, by the way, may seem familiar to you from the hearing at the Ways and Means Committee, but for a person making $400,000 a year versus, say, a person making $50,000 a year, can you just spitball what percentage of a person's income in those two cohorts, what percentage of their income goes to Social Security?
Well, the person making 50,000 is easy. It's, they pay 12.4%, half by themselves and half by their employer. For a person making, I'm sorry, that was 400,000?
Right, 400,000.
Because payroll taxes are only paid this year up to 168,600, that would leave you in a position of the payment on that amount of their earnings would cover about 5% of their total 400,000, about 5.2% maybe, 2.6% by them and 2.6% by their employer.
Great. So if you could just also comment on what enacting our proposal, you don't have to opine on its merit, but the enactment of our proposal to lift the payroll tax cap on people making over $400,000, what effect would that have on the solvency of the trust funds?
It would have a considerable effect. In fact, in Mr. Boyle's bill and from the Senate side also, let's see, I think I have a number here of what we have. It would actually reduce our long-range actuarial deficit from 3.5% of payroll by 2.26, by almost 2/3. So it would reduce our long-term shortfall by about 2/3. So it'd be a big start towards aligning revenue and cost in the future.
Similarly, Mr. Spitalnik, I wonder if you might comment how, and this follows on Ms. Schakowsky's questions, how repealing the power to negotiate drug prices would affect seniors' out-of-pocket drug expenditure costs.
So as I mentioned, the IRA has a number of provisions, some benefit enhancing, which are cost increasing, but the ones you mentioned, the negotiation provisions, the linkage to inflation, those are cost reducing. So if those provisions specifically were repealed, that would increase Medicare costs.
Thank you. I'm out of time. Nobody has to like our plan, but the fact of the matter is we've been willing to put one on paper that solves the problem. Now, we're waiting for the alternative to show up, and until it does, we're going to stick with this because I think this would get us where we need to go. With that, I yield back. Thank you.
Thank you. And now I recognize myself for 5 minutes to follow up on some questions here. I actually want to start off, Mr. Goss, as kind of a follow-up with some of the questions that Mr. Good had asked earlier. And I know it's maybe a quick thumbnail sketch, or maybe it's something that you'd need to provide to the committee after the hearing's over. But talking through that hypothetical example of a person making $60,000 a year and what they pay in versus what they receive in benefits and how that impacts the Social Security Trust Fund. Can you elaborate on that a little bit? I know if you don't have at your fingertips a little bit more than what you answered to Mr. Good, maybe I'd ask you if you could kind of thumbnail sketch that over a 35-year career of paying in versus payments out at current life expectancy.
So we do have a couple of items up on the web that we redevelop pretty much annually. The money's worth ratios, which is just what we're talking about, the present value of the contributions you and your employer made relative to the amount of benefits you might expect, or the internal rate of return, what kind of rate of return would be required. Looking at the money's worth ratios, if we look at that compared to what the benefits are scheduled to be in the future, then those are in reasonable alignment. What we currently have, though, is a situation where our scheduled benefits are in excess of what are payable in the future based on the contributions that have been made and will be made in the future, largely because of the changing life expectancy, not life expectancy, but really largely because of the changing age distribution of the population.
Yep.
Now, and we can submit much more for the record on that. Thank you.
Yeah, and that may be something that we get some follow-up information or research on that. Because, to some degree, it's kind of a math problem on Social Security, is the amount of money going in has to equal or be greater than the amount of money going out to make through that process. And that there's two factors to that. One, the number of workers versus retirees and what's being paid in, and also the life expectancy, as you mentioned earlier. What was the life expectancy when Social Security was created and 65 was set as the age in which payment, the full retirement payment was made? What was the life expectancy at that point in time?
I'd have to probably go back to the trustees report and pick that number up, but I can share with you this one, I think, interesting detail, which is back in 1983, at the time of our last major amendments, when we were foreseeing what would happen, we were projecting that by about 2015, 2018, before the pandemic, that life expectancy at age 65 would rise to, I believe the number was 16 or 16.1 years. It was much lower than that back in 1983 and earlier. And we were projected it would rise to about 16.1 years. Lo and behold, that turned out to be very accurate. So our projections about life expectancy and decline in mortality rates has been very, very accurate.
Okay, I was thinking life expectancy in 1937 was about 63 years, and that was kind of what I was trying to confirm versus today. Life expectancy, as you mentioned, it's closer to 85, 86, depends on when you calculate it on the actuary tables, which has an impact on the amount of time that you have payments going out.
Very much so. We try to focus to a great extent on what life expectancy is as of, say, age 65 being important, because much of the improvement in life expectancy from many years back was because of a reduction of early childhood and infant mortality. So a lot of that restriction down to maybe only 60-something was because many people were unfortunately perishing at a very young age, even before they would enter the workforce. Right, right. Shifting gears just a little bit, so it's correct that in 2033, the old age and retirement trust fund is going to be depleted, right, run down. The reserves depleted. And at that point in time, what was the latest expectation of, or estimate of what the shortfall was? Was it in the 22 to 23% range? A little bit less than that. I think we're at, 79% payable at that point for the OESI fund. So, yeah, and I think there's some competing numbers between CBO and Social Security, which, sometimes that just depends on how you're estimated. And I guess my concern about that is that if nothing's done, somebody who's currently getting a $1,000 check a month is going to have their check cut to $790 if it's a 79% payable, right? If nothing changes between now and then. So that's I guess the driving force and the concern, I think, on the part of a lot of folks is that we need to step up and do something about this. So we've got to make some changes in order to make sure that the folks that have paid in can get the payment out that they're expected. And that's the problem that we have a concern with. So I've run out of time. And so now I'll yield to a gentleman from California, Mr. Peters, for 5 minutes.
Thank you, Mr. Chairman. Thanks for having this hearing, and it has been too long. Apparently, I didn't realize how long it's been since we've heard from you and your teammates. We have talked a lot about Social Security and Medicare in this committee during the 118th Congress. They're vital programs we have to protect. They're going to need some reform for us to be able to pay our obligations, and for us to be able to ensure that they're available for future generations as well, who are very cynical about the prospects for getting Social Security and Medicare. I think on this side of the aisle, we all agree that the Republicans' proposals are far too extreme. The Republican Study Committee's 2025 budget proposal would slash Social Security benefits and transform Medicare into a premium support program. That's not what I want. And while the most recent trustees' report showed some improvement in the Social Security's finances, trust funds remain in trouble, and beneficiaries are still staring down a barrel of around a 20% across-the-board cut, benefit cut in the next 10 years, whether you're 72 or 92, whether you're rich or poor. For a long time, Congress has been kicking the can down the road, and now we're kicking an oil drum down the road, because this problem is only getting worse and closer to us. Let's assume that there are people who would like to cut Social Security, and I worry that in 2034, those people will say, you know, on the eve of a 20% cut, they'll say, okay, let's compromise it and call it a 15% cut instead. And they have all the leverage in the room the more time we wait to fix this problem. The best thing we could do to protect Social Security and Medicare is to act now, but the longer we wait to start this process, the more leverage those of us who want to preserve benefits lose, and more expensive a solution becomes. I co-lead the Fiscal Commission Act with my colleague Bill Huizenga from Michigan. We introduced the bill last September, have 26 bipartisan co-sponsors, including Congressman Panetta and Swazi here on this committee. Any enduring efforts to strengthen Social Security are going to require bipartisan buy-in. I think everyone's said that so far. And this is not working. I mean, as much goodwill, particularly among the two leaders of this committee there is, we are not getting closer to a solution from a legislative standpoint. I believe our best shot is an open-door, public, productive dialogue through a bipartisan commission. And if we don't act to create a commission and work through these problems, what we're going to get is not what the commission says, which is an open process. We're going to get another backdoor 11th hour deal between party leaders. And if that's not what you want, that's the road we're on. Mr. Goss, we know there's a quantifiable cost to acting to save Social Security through tax increases if we wait until just before insolvency. Can you please explain why that is the case?
I'm sorry, if we wait just to the point of 2033 or 2035, we know the extent of increase in of taxes that would be required. Where we have about a 20% shortfall, either benefits would be reduced by about 20%, or the increase in revenues would have to be at that moment increased by about 25%. Right. But that's at that point. Because of the demographics, things get a little bit worse thereafter. We reach the point many years later in the 2060 to 2080 period where we would have to have a reduction on the order of more like 25% in benefits and about a 33% increase in revenues.
Okay, so I remember you can't maximize two variables. Let's just say we're going to leave benefits as they are and just do this all through tax hikes. How much harder is that going to be to do in 10 years than it is if we acted today? What would the quantity sort of describe for lay people what the difference would be?
Well, the advantage of making changes in either, but in this case particularly tax rates early on, we'd have the next 10 years in which we would have more revenue coming in. We would not be depleting our reserves during the next 10 years, and we'd be maintaining them, and that would help us out in the amount that we have to have taxes increased at a later point in time. But the bottom line is between 2035 and 2100, there's a certain amount of shortfall we have to make that up. If we start earlier, we can spread that out a little bit more across more generations, as it's often said, but the same total amount needs to be generated.
Right, and I would just say, if we don't start something and pass it, you know, it's great for us to all have our righteous opinions about what should happen in a perfect world, but, you know, this requires compromise. It requires 218 votes, 60 votes, and a signature. We're not really doing anything. So I just want to express my appreciation to you for your work, and to my colleagues, my willingness to sit down, and I think through a commission would be the best route to figure out how to make sure that this program survives. And as Democrats, I think we're particularly proud of it, and we owe it to our constituents to save it. Mr. Chairman, I yield back.
Thank you. Now I recognize the gentleman from Oklahoma, Mr. Brasheen, for 5 minutes.
Thank you very much, Mr. Chairman. There's an education piece to this that the American people deserve. They deserve to know what's going to happen. They deserve to know who's caused the problem. So I appreciate both of you here speaking towards Medicare and Social Security solvency. So I'm going to run through some points here because the people that back home, they don't know what we've been talking about in the last hour. Social Security is going to be insolvent by 2033, Medicare by 2036. These programs have sustained American seniors for generations, initially an anti-poverty program. They have been fundamentally altered, notably in 1983, to the point that we thought we would have solvency, but we're seeing that's not going to be the case. Social Security started, again, as an anti-poverty program, not a retirement program. According to the Social Security Administration, the average life expectancy at birth in 1940 was 61 for males and 65 for females. The few Americans who made it to 65 when it was expected they could no longer work lived on an average for another 10 years. Social Security was designed to ensure that seniors were not living in abject poverty and could live out the remainder of their days with some needs met, their basic needs met. In 2024, the life expectancy at birth is 73 for males, 79 for females. Men who reach 73 on average live well into their 80s, and women who reach 79 live on average until 90 years old. Social Security has been transformed into a retirement program culturally. Some individuals are living on their Social Security checks nearly as long as they were employed. This is putting a tremendous strain on the program, especially when you consider the difference of the ratio of worker to recipient from when the programs began, notably 35 Social Security, to now. Long after its inception in 1940, 160 workers covered the cost of fully providing benefits to one Social Security recipient. In 2024, there are just 2 workers that cover the cost of fully providing benefits to one Social Security recipient. It is totally unsustainable, and it shows us what is really undermining the system. We have a larger retirement population than ever before in the United States at a time we have a tremendous labor shortage and a lower birth rate than ever before. At the same time, this problem is facing Medicare, more recipients, longer lifespans, fewer workers are paying into the system. Something that I think it's important for people to know that Medicare Part B is not supported fully by the payroll tax. It is receives contribution from the general fund. That's an important note as we're trying to categorize those that are supported fully by the payroll and that which receives some funding from the general program, which that does have an impact on how we're going to figure that out for Congress for the general purse perspective. So what happens when Social Security is going to go insolvent? According to the Peter Peterson Foundation, Social Security recipients will see a 21% cut in their benefits. Mr. Goss, you talked about it'll pay out 79%. There'll be a 21% cut. So how does that factor into what the average payment is? The average Social Security check in 24 was $1,900 a month. Is that correct, Mr. Goss?
I think that's right.
Okay. As a 21% drop would make that $1,500 per month, and that ultimately, if you're receiving $1,500 a month, multiplied against 12 months, that's $18,000 a year. CBS News estimates that Americans need to make $96,000 a year to live comfortably within a major United States city. And of course, that's not rural areas, but within a U.S. city. When Medicare goes insolvent, hospitals are going to have an 11% cut in payment for Medicare Part A, which the hospitals are derived out of. This committee held a hearing a few weeks ago specific to concerns over hospital consolidation. And, for the rural areas, the rural hospitals, that's going to be a bigger hit, a bigger impact in the economy of scale than it's going to be for the bigger ones. Congress has known that insolvency is going to hit the century, yet it's not acted, largely because to discuss these program reforms amounts to what many people in elected office consider political suicide. Luckily, I self-term limited 8 years, so I'm not gonna. I've got an insurance policy to make sure, hopefully, that I'm operating in truth and not political calculation. When insolvency does hit us, the federal government will have to pay back this $2.6 borrowed money it owes to the Social Security Administration, and politicians are looking to save their careers. I'm concerned are going to print that $2.6 trillion just to make that payment, and inflation will increase, which is going to erode the program. I want to just end with this because I'm out of time for the rest of this. Mr. Goss, give me in 5 seconds what you think, 2 different things that you think we ought to do to shore up Social Security.
Well, I'm sorry to indicate to you that as the sort of, dare we say, umpires in the ball game, we try not to take any sides onto what ought to be done. But we do know that over the long term for Social Security, we are going to have some combination of, it could be all one or all the other, or some combination of on the order of a 25% reduction in the level of scheduled benefits for the future, or a 33% increase in the revenue for the program. And it's really up to you all as the elected representatives of the American people to decide which way we go on that. Currently, I would just indicate, by the way, we oftentimes look at the benefits of Social Security about how much of your sort of career average earnings it replaces. And in general, it's around 40% or so higher for low-paid folks and lower percentage for high-paid folks. And it's really that kind of thing that I think we would all want to be talking about what kind of benefit replacement levels is appropriate. Is what we have now right, and is that what we want to sustain, or is there a possibility of making that lower? And of course, the side of that is because of the changing age distribution of the population. If we don't make changes in the benefit side, because we have so many fewer people of working age relative to the elders, because of the low birth rates largely, we're simply going to have higher tax rates to be able to sustain the obligations.
Thank you. And gentleman's time's expired. Now I yield 5 minutes to the gentleman from Texas, Mr. Doggett.
Thank you very much. Thank you for your testimony today. Clearly, the programs that you play such an important role in are vital to retirement with dignity for millions of Americans, and we need to be concerned not only about the dignity of existing seniors, but about our grandchildren, our great-grandchildren, to ensure that Medicare and Social Security are there for them. I was sworn into this Congress the same day that Newt Gingrich was sworn in as Speaker of the House. And his famous comment that he wanted Medicare to wither on the vine, I think, has guided Republican opposition to so many Medicare reforms throughout the decades. Because I served as the chair of the Health Subcommittee on the Ways and Means Committee and hope to do so again, I will focus my remarks on Medicare, even though I realize how very vitally important Social Security is. The Republican Study Committee report and recommendation that this Congress should shift those who rely on Medicare to a voucher system where they have no guarantee that they will be anything other than the victims of scam plans by private insurance brokers that do not guarantee that the doctor that they've relied on they can see or that care will be timely delivered is part of letting Medicare wither on the vine and would be a serious mistake that we have to resist at every opportunity. What we have here is not so much a spending crisis as a political crisis. We've got one party that is intent on providing an extension of Trump tax cuts that benefited the wealthiest few in our country and the giant corporations. They're willing to spend trillions of dollars in order to continue those tax breaks for those at the top and claim that we have to make significant changes in Medicare and Social Security to balance things out. The good news is that there are plans that can assure a stable fiscal approach for Medicare for over 20 years. Some of those are embodied in legislation that I've introduced that's backed by 61 Democratic co-sponsors, the Assuring Medicare's Promise Act. And what it would do is to extend the solvency of Medicare by requiring that those who are currently avoiding the net investment income tax can no longer do so, and redirecting all of the revenue from that tax into Medicare as was originally intended. We actually did that in the House through the Build Back Better legislation, which unfortunately did not get approved over in the Senate. The President's Medicare proposal goes a step further, and I believe that you have done an analysis of it and presented it to us, indicating that the President's initiative, which does involve some additional taxation, I believe the memo here from the CMS office is that would fund the HI program. It would be sufficiently funded indefinitely. Is that correct?
That is correct. The work that we did in analyzing the budget proposal included in this year's budget suggested that additional revenue would make the HI trust fund solvent indefinitely.
My concern, of course, is not only that of solvency, but of coverage in Medicare, and the fact that as important as it is, and as many people as it serves today, that it does have a number of serious gaps for health needs of our seniors. 2/3 of Americans suffer from hearing losses, yet only about 30% of the people who require a hearing aid can access one. Vision loss is another chronic condition among older adults and is leading to injuries from falls, loss of cognitive function, and depression. And we've got about 70% of our seniors who suffer from serious periodontal disease, and 1 in 4 don't have any teeth at all. I believe we can cover the cost of this kind of care, of strengthening and improving Social Security, by lowering outrageous prescription drug prices, prices that are higher than anywhere else in the world. And I believe you have also indicated that to the extent that Congress might choose to cover more drugs than is covered by the very narrow provisions of the law that is in place on drug negotiation, to the extent it removes some of the, what I consider to be outrageous restrictions on the types of drugs that can be negotiated, that anytime we expand negotiation, we not only save money for seniors, but it will mean a better position for the Medicare Trust Fund.
It is certainly possible that including more drugs subject to negotiation could generate additional savings to the Medicare program.
And the other area that the independent MedPAC has recommended as a way to strengthen the fund is to look at the Medicare Advantage program, which was presented to us as a way to save money but costs more money for every recipient we cover, costs much more than covering through traditional Medicare.
The gentleman's time's expired. If he wants to ask another question or make
Sure.
another comment, I'm okay with it, but then we're going to have to cut it off.
I appreciate it, and I appreciate your testimony. I think we have a prescription for a better future for Medicare, strengthening, expanding it, not undermining it with a voucher system. And I yield back.
I thank my friend from Texas and now yield to, I think, the last remaining member here, although they may trickle in. My friend from California, Jimmy Panetta, for 5 minutes.
Thank you, Mr. Chairman. I appreciate that.
And some change, maybe.
There you go. Thank you. Appreciate you and the ranking member and the way you do things on this committee. And having hearings like this is part of it, so thank you very much. Obviously, this is one of the many important hearings we've had here on the Budget Committee, given the long-term solvency challenges to Medicare and Social Security trust funds. I think we all know, and as we've heard today, Americans pay into these trust funds for most of their working lives, and in return, they expect to receive the benefits from these two trust funds, Medicare and Social Security. However, as we've been hearing and as we know, the insolvency of these trust funds threatens the future of the programs. So clearly, we got to act soon. I think we're hearing the issues today, and ideally, what we want to get, as I always say, we want to get to solutions. Now, the Old Age and Survivors Insurance Trust Fund is expected to deplete its assets in 2033, and the Hospital Insurance Trust Fund is expected to deplete its assets in 2036. We have basically 9 years before the first trust fund faces insolvency, but as you know, delaying action on financial matters often makes those matters worse. Mr. Goss, how would delaying action affect the scale of the changes needed? And if changes are made at the projected date of trust fund solvency, what kinds of changes need to be required?
Our trustees have consistently for many, many years indicated the great advantages of acting sooner, which are, first of all, that there are more options on the table the sooner that you all act. The other is we give more advance warning to individuals who will be affected. And the third is that actually the level of reductions that are necessary at the point of reserve depletion might be somewhat less, but not dramatically less. As indicated on one of the earlier questions, if we were to actually enact and effect changes immediately, that would help us in terms of satisfying the reductions necessary as a whole over the next 75 years. But the key thing, really, I think what the trustees have put forth is to enact as soon as possible so that we will have lots of options to consider. We can spread the reductions or the cost over more generations, and that will give advance notice to people as to what they will be facing. The actual scale of the reduction that we need over the next 75 years is basically the same total amount of money in present value. But there are great advantages to enacting and even starting to have some effects earlier.
Great, thank you. And Mr. Spitalnik, on Medicare, the same question.
Unfortunately, it's the same answer, that delaying of response means that there needs to be a more dramatic response later on. And so the shortfalls are different in the Medicare program, specifically for the HI trust fund. But delaying action means that more action would need to be taken at that point.
Now, I want to talk about a question dealing with the payroll tax cap. Obviously, the Old Age and Survivors Insurance Trust Fund, Disability Insurance Trust, and Hospital Insurance Trust Funds, they receive most of their income from payroll taxes. However, according to the Social Security and Medicare Trustees Report, the income from payroll taxes, yes, it accounted for approximately 90%, 97%, and 88% of each trust fund's total income, respectively. Yet there is a $160,000 cap on the income that is subject to Social Security payroll taxes. Mr. Goss, again on Social Security, how has this cap grown in relation to the income of the average American worker?
Well, in fact, as specified back in the laws in the early 1980s, the taxable maximum has been indexed automatically to the growth of the average wage level of all workers in total in the economy, and it has grown at that rate. Our issue is that there's been a redistribution of earnings across the top 6% of earners and the bottom 94% of earners that was not anticipated back in 1983. And with that shift of having a much greater share of all earnings going to the top 6%, that's above our taxable maximum, an issue that is not suffered by the hospital insurance fund, but for the OESI and DI trust funds, that's an issue. Just a little note on that. The top 6% between 1983 and 2000, over that 17-year period, the real growth over and above inflation for the average earnings for a person, for people who are in that top 6%, was 62% real growth over that 17-year period. For the bottom 94%, it was 17% real growth in the average earnings. So it's been really that shift that has really changed us from having an expectation of reserve depletion way back in 1983 for OESDI of 2063 to now 2035. It's the lion's share of the issue.
Thank you for that explanation. I yield back.
I thank the gentleman from California. I think we have exhausted everybody's who has been present, their questions and comments. I think Ms. Ballant was trying to make it back. Mr. Peters, do you have another comment or question that you'd like to ask? Mr. Panetta? Okay, well, let me just close then. If she gets back by the time I finish my 1-minute closing remark, we'll try to get her question and her comment. But I'm going to end where I began, which is, and with the affirmations from you, Mr. Goss, the last time we addressed these issues in a meaningful way and in a sustainable way, there was a bipartisan commission called the Greenspan Commission. And there were leaders like Tip O'Neill and Ronald Reagan willing to work together. No party has been able to, on a unilateral basis, address this issue, no matter how grand of the plans that they promote. They haven't been able to get it across the transom, not within the Republican Party or the Democrat Party. So I'm from West Texas, and it just seems to me a common sense deduction to arrive at a mechanism like a bipartisan commission and the kind of leadership that we need to bring the two parties together and the various strategies to solve the insolvency and unsustainability of these programs. Ms. Ballant is here. I have done my best I did my best senatorial act and filibusters. Yeah, no one's better. With friends like Scott Peters, ladies and gentlemen. Ms. Ballant, you have 5 minutes, and then we're going to wrap this up.
I appreciate that very much. I apologize. Often in Congress, you're running between two committees, which was the case today for me. So I appreciate, Mr. Chair, your efforts, and very happy to be here. This is an important issue for me. I represent Vermont, and we have about 640,000 people in Vermont. We're tiny, tiny but mighty. Out of that roughly 640,000 people, 183,000 are people over 60. So, Medicare, Social Security, incredibly important to my constituents. And what I found is there are a lot of myths regarding Social Security in particular that distress many seniors in my state, but also younger people who really fear from the rhetoric that they hear around Social Security that there will be nothing left for them when they get to be retirement age. So one study recently found that 74% of Gen Z fear that Social Security will run out of funding in their lifetimes, and 45% believe they won't get any Social Security benefits, and millennials roughly, feel the same. The Social Security and Medicare Board of Trustees annual report showed that combined old age and survivors insurance trust fund and the disability trust fund will be able to pay 100% of scheduled benefits until 2035, and afterwards 83% of benefits will be met. So question that I have, Mr. Goss, do you believe Social Security will completely run out of funding before younger adults can receive Social Security benefits? I think it's very important for us to address this head on.
I would say, if you say completely run out of funding, clearly not, because even if we do reach the point where we deplete our now $2.8 trillion of reserves and have that savings account in effect depleted, we will still have coming in on a daily basis the revenues from payroll taxes and income taxes that beneficiaries pay on their benefits. That would continue coming in. But as you indicated, covering at that point of reserve depletion, about 83% of the continuing costs of paying full scheduled benefits. So it would not go to zero. It wouldn't be that there'd be running out of money or having no benefits, but a reduction unless you all act to counter this.
Right. And so, I just think it's such an important point because when we use rhetoric like it's bankrupt, it's collapsing, it's, there will be nothing left, it certainly raises anxiety for people, but also I think it fundamentally paralyzes us from being able to do the work that we need to do to make sure that people can retire with dignity and security. So Democrats have put forward a plan to protect Social Security for future generations, the Social Security 2100 Act. It was a bill championed by my colleague, Congressman Larson, and it will increase benefits 2% on average for all Social Security beneficiaries for the first time in 52 years. And so, from your perspective, what is it that Americans don't understand about Social Security generally, and how can we be better about messaging for them, basically what it has done for them, what it will do for them, and how do we go about protecting it and move beyond the rhetoric? And that's to both of you.
Well, let me take a little shot at that. First of all, I think one of the things that's important for people to hopefully understand is from the very beginning, Social Security was intended to be what we sometimes refer to as a floor of protection. It wasn't intended to provide everything that you will want or need in retirement. Generally, financial planners say you should expect to have maybe 75 to 80% of your earnings level that you had when you were working continuing. Social Security, on general, is intended to provide only about 2/3 of that, only about 40% or a little bit higher than that. So it's expected people have some personal savings and hopefully have some employer-provided plans. Some of those are not working out as they should, so Social Security has become all the more important. But we should really, I think, make sure that people very much understand that. The other thing that people should understand is that Social Security is not a bank account. All the money that you put in is not saved up for you for when you retire. It's sort of what we call a pay-as-you-go system. It is intergenerational. And the reduction in the birth rate and the changing age distribution as a result is really putting pressure on doing that, which simply means that if we have fewer workers per beneficiary because the birth rate was lower, we're going to have to either have lower benefits per beneficiary or higher taxes per worker. There's really not a lot of way around that. We just have to make the adjustments.
Appreciate that. I see that I'm out of time, and I don't want to keep anyone longer than we already have. The other piece of this, though, if I could, Mr. Chair, is absolutely, it is supposed to be supplementary. I think the challenge for all of us right now is the wealth gap in this country is become a chasm. And so we are not seeing that most working people have anything left over to put aside for retirement. Thank you, Mr. Chair. I really do appreciate that you gave me
But, no,
time.
this is important. We need the fullness of our discussion and understanding. And to your point, whether we agree or disagree on the approach, we need an understanding by the American people. And just the points you hit about its supplemental nature and not to put all your eggs in one savings in one basket per se, but among other things that we need to educate the American people on in this regard. So thank you for your comments. And now to our last Republican member and then our last Democrat. I know I keep promising we got one more, but they just keep coming. The hits keep coming. Lloyd Smucker from the Keystone State for 5 minutes.
Thank you, Mr. Chairman. Good afternoon, Mr. Goss and Mr. Spatonik. Did I have that right? Close, I guess. But, sorry, I couldn't be here to hear much of the discussion here, and I apologize if some of my questions have already been covered. But this is a really important topic. I was part of 2 other hearings, and so, but I'm really grateful to the chairman for continuing to talk about this and to each of you for being here. We obviously all want to work to ensure that the promise of Social Security and Medicare, people have been paying into these systems. We want those promises to be kept, but we also know that structurally going forward, if the changes aren't made, we won't be able to do that. And so it's a very important conversation. I do want to talk about, Mr. Spatonik, the Medicare funding warning, quote. This year, the trustees issued a Medicare funding warning. Can you explain what that is? And what does that require as a response from the legislature or the president? Is it a trigger of some sort that is intended to require some action? So give us a background on that.
Sure. I think it started back in the Medicare Modernization Act, back in 2003, put in this requirement where the trustees would evaluate the proportion of revenues that were dedicated sources, and when that proportion exceeded 45%, this warning would effectively be triggered if certain conditions were met over 2 consecutive years. Effectively, if there was more than 2 consecutive years of general revenue, general government contributions into the Medicare program, when that exceeded this 45%. It was somewhat of an arbitrary.
Yeah, I was going to say, why did we pick those numbers? Arbitrary, as you said. But the idea is what? Why do we do it?
So when this was, in response to a Medicare funding warning, the Congress has asked that the president, in response, in their subsequent budget, would provide proposals that would address that particular circumstance. So they'll get the proportion of funding dedicated down to that 45% level. My understanding is that the executive branch under different party leadership have each concluded that, in their opinion, that provision, that requirement that they actually provide a proposal in response to that trigger is unconstitutional. And I am far from a constitutional lawyer, and so I will not opine on any of that, but as part of the work of the Board of Trustees, they do calculate and determine whether this trigger is reached or not.
I would certainly like to understand that. It doesn't seem to me like it would be unconstitutional or require action by the executive branch, by the president, by the administration, when we've crossed some threshold, even if it is arbitrary, when we know there's going to be problems going forward. So certainly that would have been the intent. of the previous Congresses who put that into law, so I hate to see it ignored. I mean, and we also know that the longer we wait, the harder this is going to be to resolve. You would both say, I'm sure, that it's important for the administration to work with the legislature to come up with proposals to solve this, and the sooner the better. Do you agree with that?
I would completely agree that the nature of the problems, the issues surrounding both the Medicare and the Social Security program require bipartisan collaboration in terms of addressing them.
Sure. This committee probably was talked about before today, but passed out of committee here a bill that would create a commission that would be intended to do just that, where it would be bipartisan and maybe even members of the administration who essentially hold a conversation with the American people about what we're faced with. Like, if action isn't taken in 9 years, people will get 80% or something like that of the check, Social Security check that they should receive. Do you both support that? Do you think that would be valuable for that to occur?
As back in 1982, the so-called Greens came, there was also a commission back in 1979, which made a big head start on it. And having that conversation is really important. We have, because of many, many members of Congress putting forth proposals for affecting Social Security, we have a large list of provisions and proposals up on our website to sort of look at and choose from. A commission that would look through all of those possibilities and come to a consensus would be a really good thing. And your point about sooner rather than later to inform the American people would be a very good thing.
I'd also agree that the sooner these problems are discussed and ultimately addressed, the less significant those changes will need to be. And so the earlier, certainly the better.
Thank you. Thank you, Mr. Chairman.
I thank the gentleman from Pennsylvania and his leadership on the bipartisan fiscal commission that would look at these various provisions and find consensus. And our newest member, Tom Swazi, from the great state of New York. You have 5 minutes for your question, sir.
Thank you, Mr. Chairman. Thank you, Mr. Spitalnik, Mr. Goss. Appreciate your time. I want to try and learn something new from you guys here today, if possible. So with any issue that has to do with budgets, the only way to solve it is to either raise revenues or reduce expenses. There's no other choices, right? That's the only thing you can do. So to reduce expenses, some people are proposing that we should raise the retirement age. I don't like that idea because people who work in outdoors or blue-collar jobs, once their bodies turn 65, they can't work in those conditions anymore. Even though I know the life expectancy is longer and things like that, but blue-collar people are very vulnerable. The other thing you could do is you could reduce people's benefits. And nobody's going to like that idea. That's, that's a very unattractive thing to reduce people's benefits. Another way to reduce expenses is to negotiate the prescription drug price for the Medicare program is to negotiate the prescription drug prices, which would hopefully reduce prescription drug costs for the Medicare program. Are there any other ways that you guys know of that you can reduce the expenses other than those 3 things that I talked about? Either one of you? That people are talking about?
I think abstractly, you have it exactly right, that the only way to improve the financial condition is to either increase income or to decrease expenditures. There are a number of ways to go about considering decreasing expenditures, and there's a long list.
Could you give me a couple of them, just so I know?
Decrease prices is one way, but...
That's the one I talked about already. Are you talking about for all kinds of healthcare costs?
Well, you don't necessarily have to negotiate drug prices. So much of the Medicare program have their prices updated each and every year, often related to inflation. And so there are certain provisions in the current law that have some of those updates increasing slower than rates of inflation. So that's already baked into existing estimates that some...
Could those be cut more than they are? Could those costs be reduced more?
The funding deficiency, so the current deficit accounts for already those reduced.
Could they be reduced more beyond the existing numbers, the existing projections?
It is certainly theoretically possible to
And what would happen? You'd make the pharmaceutical companies mad, or what would be the other, what's the theoretical thing stopping you from doing that?
Well, you all have the privilege of establishing what the payment rates are.
Oh, it's up to us?
It is up to you.
Oh, okay, all right. Are there any other ways to reduce the costs other than that?
Well, what I would add is the retirement age change, which we had back in the 1983 amendments. One little clarity on that is the Greenspan Commission did not recommend an increase in the retirement age. That was the 1/3 of the changes in the 1983 amendments that did not come out of that commission. That was developed in conference committee. It was a joy working with Moynihan.
Okay, but I mentioned that
and
one
all the
before.
rest
You
of it.
could increase the retirement age, so.
Increase the retirement age is certainly an option here, but there's one thing to be aware of. We had a bipartisan commission back, the Simpson-Bowles Commission in 2010, where there was talk about retirement age, and there's an aspect of that could be considered to the extent that you look at retirement age changes, which is not to have it apply to everybody in the same fashion as the 1983 amendments did.
Make it different for blue collar versus white collar jobs.
Exactly. We couldn't actually differentiate by the type of work, but long career people with low earnings levels, that commission came up with a way that we worked with them to have less or maybe no increase in the retirement ages for people long career, low income. So that's a way that you can mitigate the effects if you do have that.
Okay, so the other way is to raise revenues. And the way to raise revenues is to increase people's taxes, which nobody likes that idea, or to apply the existing tax rate to people above $400,000, which we heard a lot about today. And what about getting more people to actually pay into the system? Are there a lot of people who live in America today that are not paying into the Social Security system or the Medicare system?
Well, one thing we have is that there are about 1/4 of state and local government employees currently are in plans so that they're not paying into Social Security. They're in a separate plan. They're covered by their state and local pension plans. And that's about 4% of total workers.
Yeah, we're probably not going to mess with that one. Okay, how about other people? How about like the undocumented workers in the country right now? Are there a lot of those folks that are not paying Social Security taxes, or are most of them paying Social Security taxes?
That, of course, is difficult to say. Of the maybe something like maybe 10 or 11 million individuals we have who are undocumented in the country, a substantial share of them are actually paying in taxes, and as one of the members indicated earlier, by and large, they probably wouldn't even be getting benefits, so that's very much a plus. But there are a number of people who are working in the so-called underground economy and not paying taxes.
Is there a way to improve those numbers to get more people paying in? Is it just an enforcement issue? Is there, let's say, for example, if you could get 5 million more people paying into the system than we have currently, what kind of dent would that make in the problem? You talked earlier about 2/3 of the problem will be addressed from the, what did you say before? The 2/3 of it will be addressed from, paying people over $400,000 paying.
Right, yeah.
So if you added 5 more million people to the system paying into Social Security, would that take care of the other third, or would you need more than that?
If we had 5 million more people paying in on a base of about 150 million workers paying in now, that'd be about a 3% increase in the number of people working. They would probably not be at the average earnings level that we have for everybody else. So it'd be much less than a 3% increase.
So for a third, you need 50 million more people, you're saying?
We need a lot more people.
Okay, thanks very much, guys.
I thank the gentleman from New York, and I really appreciate the line of questions. And I think there is a body of work of questions on pay-fors and programmatic reforms in total that if the likes of a Tom Swazi and a Lloyd Smucker, for example, could sit down and have the conversation about where there is consensus within those two buckets of ideas, I bet we could come out and solve it. In fact, I bet if you just randomly selected, this is a sad commentary, but I'll end on a criticism of this institution. I bet if you randomly selected 10 high school students from around the country and you gave them the same set of considerations and reform ideas, I bet they could come out with a consensus solution that would be something that most of Americans would accept as logical and common sense and on balance good for the public good. So it seems to me like the question is, then why can't thoughtful leaders who are elected by the people, I would suggest there are political forces that keep us in our respective corners instead of at the table with our sleeves rolled up and ready to do the people's business and solve this problem. But that's our problem at this point, to some extent, I should say. Not necessarily yours. You're just bringing the numbers. Thank you for doing that this morning, Mr. Spitalnik, Mr. Goss. We appreciate your time. And I have to say something before I gavel. Thank you again. Okay, got that. Please be advised that the members may submit questions to be answered later in writing. Those questions and your answer will be made part of the formal hearing record. Any member who wishes to submit questions for the record may do so within 7 days. And with that, we're adjourned.